because when you have diabetes, one of the problems with diabetes is you lose some sensation in the nerve endings. And so typically when you're having a heart attack, you'll see people clutch their chest. Oh my God, I'm having chest pressure, chest pain. Sometimes diabetics won't have that, and it's possible that they can have a silent heart attack. But there was no evidence that Mr. Floyd had any type of heart attack, a silent heart attack or a non-silent heart attack.
And so you talked about this a little bit, about the notion of a cardiac arrhythmia, the fluttering of the heart. I think you referred to as either the VFs or the VTs, ventricular fibrillation or ventricular tachycardia.
Right.
Was there any evidence that he had either one of those?
No, there was no evidence that he had any of those.
When somebody is suffering from ventricular fibrillation or tachycardia, did you describe that as what we might refer to as a sudden death event?
Yes, so ventricular fibrillation can certainly cause sudden cardiac death. That absolutely could be described as that.
And again, in viewing Mr. Floyd and his encounter on the videos from May 25th, did Mr. Floyd die a sudden death?
Mr. Floyd died a gradual death. It would not be considered the classic sudden death from the standpoint of how you're putting into that context, meaning when people have that ventricular fibrillation, that VF arrest, they literally go from being fine one moment to completely out the next. You know, I don't know what happened. I was sitting next to him, and he keeled over and was on the ground. And then that could have been a VF arrest. So sometimes there's semantics in terms of this. But in the case of Mr. Floyd, yes, he did have a cardiopulmonary arrest, but no, he did not. There was no evidence of a sudden cardiac death from VFib or any other malignant heart arrhythmia.
Okay, so we've talked about your review of the medical records, and we've talked about your review of the video. The third thing you said you reviewed was the autopsy report and findings.
Yes.
What were you looking for with respect to the autopsy report and findings?
Sure. So we're talking about the autopsy report here towards the end. I actually looked at the autopsy report first. Then I went back to the medical records that we've already talked about in the videos, and then I went back to the autopsy again. So what I was looking for in the autopsy was, well, first of all, everything. When we get an autopsy, oftentimes you'll get it because you're looking, could there be something that we weren't aware of that could have happened? But in addition to looking at all the findings, my major focus, of course, as a cardiologist, was anything and everything related to the heart.
What did you find?
You know, it's interesting. I think what was most important, what I did not find. So what I found was that his heart architecturally looked normal. He had a description of coronary artery disease, which I found notable because, as I mentioned before, he hadn't carried a diagnosis of coronary artery disease. Now, I mentioned that I found it notable. I certainly didn't find it unusual because, unfortunately, coronary artery disease is so common. I mean, statistically, not to scare anybody, many of us in this room likely have coronary artery disease. I looked at whether there was any evidence whatsoever that Mr. Floyd could have had a heart attack based on autopsy. So when I looked at those arteries around the heart, I not only looked to see how narrow they were and what the composition of that narrowing was, but also whether there were any platelets or clotting factors or anything else of that nature in the arteries, which is what would be there if there was a heart attack.
And then did you see evidence of the platelets you would expect to see if Mr. Floyd had had a heart attack?
No, there were no description of any of the platelets or clotting factors or anything that would block off an artery. None of the arteries were totally, the word we'll often use is occluded, totally blocked off, which is what happens in a heart attack.
You know, I want to ask you about some of your specific findings in this regard, but first, for the jury, would you just tell them whether you excluded coronary artery disease as a cause for Mr. Floyd's death?
Yes. I have excluded that with a high degree of medical certainty.
Now, you talked about looking for evidence of platelets from the autopsy report and that you would expect it to have seen those if he had died from a heart attack, and you didn't see them.
Right.
What else did you see?
Well, so what I also saw was I looked at the heart muscle itself. So not only did the heart muscle itself not show any evidence of any injury at all, which you would see, like what if you mentioned the silent heart attack. What about a few years ago somehow he had a mini heart attack? You would see evidence of that in the heart. You would see scar tissue, etc. So not only did I not see any evidence of a heart attack, the pathologist did a very good job, in my opinion, actually, of describing what's called the endocardium. The endocardium is the innermost lining of the heart. And that is the most susceptible part of the heart to cardiac injury. Even the smallest of heart attacks will always originate on that endocardium, the inner lining. And the endocardium was not only described as normal, it was described as smooth and glistening, a completely normal finding, no evidence at all of even small microscopic injury.
Were you able, by your looking at the autopsy report on the heart, to tell whether there's any evidence as to whether Mr. Floyd had ever had a heart attack, even going back into the past?
Yeah, no evidence whatsoever of a previous heart attack.
Doctor, what is ischemia?
So ischemia is a reduction in blood flow to any organ of the body. That could be the heart, it could be the kidney. That can lead to basically insufficient delivery of oxygen for a short period of time. And if ischemia continues to occur for long enough, that can sometimes cause some irritability in that organ. But it's important to distinguish ischemia from infarct. Infarct is actually what we mean when we attack. When a marathon runner goes on a run, their muscles will get temporarily ischemic. When we lift muscles in the gym, and they talk about feeling the burn, that means you are feeling ischemia. You're feeling lactic acid buildup, and that's what ischemia is.
Any evidence of ischemia?
Not in the autopsy, no.
Let's talk about the blood vessels, the arteries, and the plaque that was in the arteries. Were you able then to eliminate the occlusions, the blockage in the arteries, as a contributing cause to Mr. Floyd's death?
Yes, I'd like to clarify. I saw no occlusions, meaning I saw no complete blockages. There were narrowings. There were narrowings in more than one blood vessel. Importantly, the main coronary artery, it's called the left main coronary artery, there was no description of any narrowings or disease in the left main coronary artery.
Why is that significant?
Well, because that is the very first pathway that blood travels down to then branch off into multiple other arteries. And so left main disease, as we sometimes call it in cardiology, is among all of the vessels probably the highest risk blood vessel if it were to get blocked off.
So how would you characterize the nature of the then plaque within the artery? Was it soft? Was it fractured? How would you characterize it?
I would characterize it the way that the medical examiner characterized it. I'm not an expert at characterizing plaque at a microscopic detail, but what I did appreciate was the description of what seemed to be not only relatively conventional looking artery narrowings, plaque buildup that we all will eventually get in our arteries, but also in one of the arteries, it was described that there was an element of calcium. And I only mention that because that also indicates that this coronary artery disease didn't just kind of develop right away. It was probably a slow, gradual buildup of the narrowings, and that actually is a very clinically relevant finding in the field of cardiology.
Doctor, did you make any assessments around the size of Mr. Floyd's heart?
Yes, I did.
Would you tell the jury about that?
Sure. So when looking at the size of his heart, not just the size, but the thickness of the heart, it was described as being mildly thick or mildly enlarged. Now, depending on which criteria you use, one criteria would agree with that it was mildly thick or enlarged. Others would suggest that it was in the normal range. I do believe that it was likely mildly thick and mildly enlarged. It is an expected finding in somebody that has high blood pressure. So even though there are some scoring systems that might say it wasn't even enlarged at all, in my view as a cardiologist, I do believe there was just the smallest element of increased heart thickness. And as I mentioned before, that's important because that's exactly what the heart is supposed to do when there's high blood pressure. That is a normal response. The muscle's getting stronger. It's allowing the heart to work and work well. Now, if that goes on for, like I said before, 20 years, we can have problems. But early on, having a mildly thickened heart is not only a normal finding in someone with high blood pressure, it may actually be beneficial in the short term.
Doctor, putting all this together, did you see any evidence at all that the primary cause of Mr. Floyd's death originated in his heart?
No, I did not.
Let's talk about a new subject. Whether or not Mr. Floyd suffered from a drug overdose and died from a drug overdose.
Okay.
That was something that you also considered as a cause.
Yes, sir.
Were you or are you familiar with Mr. Floyd's toxicology results?
Yes, I am.
What or which substances did you consider in evaluating Mr. Floyd's toxicology history?
When I looked at the toxicology reports, I focused mostly on the finding of fentanyl as well as the finding of methamphetamines.
What role, if any, do you feel that the fentanyl played in the cause of Mr. Floyd's death?
As far as I can tell from reviewing all of the facts of the case, I see no evidence at all to suggest that a fentanyl overdose caused Mr. Floyd's death.
As cardiologists, do you occasionally have to care for patients who struggle with opioids or opioid addiction?
Absolutely.
So here you found that the fentanyl, in your opinion, played no role in Mr. Floyd's death. Would you tell us why it is you hold that opinion? How do you reach that conclusion?
Well, I think I would break it down to just two major reasonings. Number one, it appeared to me that Mr. Floyd, who was an acknowledged frequent chronic user of substances, particularly opiates, likely developed a high degree of tolerance. There's even one emergency room visit that I had reviewed where he came in and he told the emergency room team that, you know, he was tearful and says, "I'm having trouble with substance abuse. I think he said I took 8 Percocets within 2 hours. He had no side effects from that at all. They observed him for a couple hours and they discharged him. And just so looking through it, looked like he had built up a high tolerance just in general to opiates. But the second, and just as important, maybe more important, was I didn't see any of the signs of an opiate overdose when I reviewed the videos.
And when you then are referring to the signs of an opiate overdose, would you tell the jurors or describe for them what are those signs and what didn't you see?
Sure. So in my experience in the intensive care unit, taking care of patients who come in with an opiate overdose, first of all, they are usually extremely lethargic, oftentimes nearly unarousable. And then you try to wake them up and they're falling right back asleep. They're not talking to you. If they are talking to you, they're often having slurred speech. If they're standing up, which they wouldn't be if they had a fentanyl intoxication and overdose, they would have to imagine get pretty dizzy pretty quickly. I kind of saw all the opposite with Mr. Floyd. I saw that he was alert, he was awake, he was conversant, he was walking, and yet, according to the toxicology report, he had this degree of fentanyl in his system. So just looking at the clinical story, I didn't see any signs or symptoms of fentanyl overdose.
Let's turn to methamphetamine then. What role do you feel that methamphetamine played in Mr. Floyd's cause of death?
I feel it played no substantive role at all.
And why is that?
Well, all considering, it was a very relatively low level of methamphetamine in his system. And so when you look at the context of the case and you see a relatively low level of methamphetamine in the context of everything else, I felt very confident that that low degree of methamphetamine was not what was triggering this profound cardiopulmonary arrest and ultimately PEA arrest.
So, Dr. Rich, then, taking into account all of the evidence that you reviewed, do you have an opinion to a reasonable degree of medical certainty as to whether Mr. Floyd's death was preventable?
Yes, I do.
Would you tell us what that opinion is?
Yes, I believe that Mr. George Floyd's death was absolutely preventable.
Were there critical points in time during his subdual and restraint on the ground when you feel measures could have or should have been taken that would have preserved his life?
Yes, I do. I think there were several junctures, actually.
Would you tell us about those?
Sure. Well, the first, of course, was to not subject him to that initial prone restraint positioning that he was subjected to. I mean, that is first and foremost. So if that was not the case, I don't think he would have died. The second, though, was when he was in that subdual and restraint positioning, and he was stating repeatedly that he can't breathe, and he was getting a little weaker in his speech. There was one moment in the video where I heard one of the officers saying, I think he's passing out. That would have been an opportunity to quickly relieve him from that position of not getting enough oxygen, perhaps turn him into a recovery position and allow him to start to expand his lungs again and bring in oxygen and get rid of carbon dioxide. So in addition to not putting him in that position in the first place, when there were signs that he was worsening, repositioning him, I think very likely would have also saved his life.
Was there a point in time, Dr. Rich, when Mr. Floyd was checked for a pulse when he was in the subdual and the restraint of Mr. Chauvin?
Yes, there was.
At the time that he was checked for a pulse and he no longer had one, in your opinion as a cardiologist, was there anything Mr. Chauvin could have done at that point in time that would likely have saved Mr. Floyd's life? Well, at the time that Mr. Floyd is determined to have not had a pulse, what is your opinion, to a reasonable degree of medical certainty, as to what Mr. Chauvin may have done that would have potentially saved his life?
Overruled. You can give an opinion.
Well, just prior to that point, I heard one of the officers actually ask, actually on 2 occasions, if Mr. Floyd should be turned onto his side. And the response was, no, just leave him. And once the officer announced that he did not have a pulse anymore, I think he actually said he does not have one, was the exact words. At that point, the immediate response would then be to not only relieve him of the restraint, But at that point, now you've got to start CPR. You've got to start immediate chest compressions, because we know that if you can get to a patient right away, even when they've lost their pulse, even when they've gone into a cardiopulmonary arrest, there is a significant opportunity to save a life. But for every minute that transpires that you are not performing the basic life support and CPR measures, the literature would suggest an approximately 10 to 15% less chance of survival. It is why we pour so many resources these days into community education and training for bystander CPR, because it's so effective and it works if the person can be tended to quickly enough.
Then from your review of the video, where you could see Mr. Floyd and Mr. Chauvin there on the ground, if Mr. Chauvin knew CPR, did you see any reason from your observation that he could not have supplied CPR?
Not within the opinion, medical opinion, so that is sustained.
I'm sorry, Your Honor.
Sustained.
All right.
It's not a medical opinion, counsel.
So at the time then that Mr. Floyd was actually put into the ambulance from the scene, in your opinion as a cardiologist, what would have been the prospects of resuscitating him at that point?
Overruled. You may give an opinion if you have one.
So at that point, I think the chance of meaningful survival, unfortunately, was very low, because I counted the number of minutes that he was on the ground, pulseless, without any CPR. And by the time the paramedics rushed in to get him and to get him onto the stretcher and into the back of the ambulance, at that point, a lot of time had passed. I give tremendous credit to the efforts of the paramedics and the doctors and nurses in the emergency room. I mean, they worked on him for what seemed...
Sustained. This is non-responsive.
Dr. Rich, do you have an opinion to a reasonable degree of medical certainty as to whether Mr. Floyd would have lived if not for the 9 minutes and 29 seconds of subdual and restraint?
Objection.
Overruled if you have an opinion.
Let me finish my question for you, Dr. Rich. Do you have an opinion as to whether George Floyd would have lived if not for Mr. Chauvin's subdual and restraint of him for 9 minutes and 29 seconds on the ground?
Yeah.
Overruled. You may give an opinion if you have one. A reasonable degree of medical certainty.
Yes, I believe he would have lived.
Last question, Dr. Rich. Do you have an opinion as to whether a completely healthy George Floyd, that is, any healthy human being, would have survived the subdual and restraint that Mr. Floyd suffered during the 9 minutes and 29 seconds on May 25th of 2020?
Objection calls for speculation.
It's sustained is irrelevant as to a general person.
I'm sorry, Your Honor, I couldn't hear you.
Sustained.
My question for you, Dr. Rich, is would any person, a healthy person, have survived the circumstances or conditions that George Floyd underwent during the 9 minutes and 29 seconds on May 25th of last year?
Same objection.
Sustained.
No further questions, Dr. Rich.
Thank you.
Members of the jury, let's take our 20-minute mid-morning recess. Let's come back at 11:25.
Thank you.
Just a reminder, Doctor, you're still under oath.
Morning, Doctor.
Good morning.
Thank you for being here with us today. Just a few questions for you. Shouldn't take too long. Just to confirm, you're not a pathologist yourself, correct?
I'm a cardiologist.
The vast majority of the patients that you treat are in a clinical setting, correct?
Correct.
Meaning they're alive generally when they see you?
Yeah.
All right. Can we agree that it is a pretty common occurrence that people die who have arteries that are 90% blocked?
No, sir. Well, everyone dies eventually, but not from the 90% blockage.
People die every day who have a 90% blockage.
People die every day from heart attacks.
Well, there's a difference between a heart attack and heart failure, right?
Heart attack and heart failure, you are correct, are completely different terms.
Okay. So people who have a 90% blockage may have a cardiac event and may die.
As a hypothetical,
Yes.
hypothetically, there are undoubtedly people who have died from coronary events with 90% blockages or without blockages.
Okay. And people may not experience pain, right, as a result of an arrhythmia?
Correct.
And sometimes people have a 90% blockage of the right coronary artery and a 75% blockage of the left anterior descending artery, and they die, right?
Again, this is a not this case we're talking about.
Exactly. Hypothetically.
In a hypothetical case, somebody who has any extent of coronary disease, including the descriptions that you just gave, could potentially die. Sure.
And again, they may have no pain associated with a fatal arrhythmia, right?
Fatal arrhythmias often are not associated with pain, in fact.
You would agree that Mr. Floyd did have coronary artery disease.
Absolutely.
And how is that normally, in a living person, how is that normally diagnosed?
So usually the patient has symptoms. So they will have chest pain or they're exercising, right? If you're an active person, you shouldn't have chest pain. And if you come to the doctor and say, something's not right, every time I try to exert myself or it feels like the elephant on the chest is the classic description. So that would be one of many possible ways that you would diagnose coronary artery disease in someone who is alive.
You may also do a stress test.
Sometimes.
A blocked right coronary artery that can contribute to a fatal arrhythmia.
Anyone can have a fatal arrhythmia with or without coronary artery disease.
And so if a blood vessel is blocked and blood is not getting through that vessel, what happens?
Well, it depends, but I'd like to answer that for you. So in the case of Mr. Floyd, what has most likely happened, based on our understanding of coronary physiology, is precisely because he had a narrowing of up to 90% and it had calcium in it. We know that that developed gradually. And the heart is fascinating in what it does. It develops what's called coronary collaterals, which means the body makes additional blood vessels so that if there's one artery that's narrow, it recruits and builds many more blood vessels to supply blood to the heart. It's actually why you are more likely to die from a heart attack if you started with a lesser narrowed artery and the plaque ruptured and blocked the vessel than if you started with a more severe narrowing because of all these unbelievable coronary collaterals and adaptive responses that the heart does when that happens.
What is a safe dose of methamphetamine?
Prescribed?
Illicit.
I would never consider any illicit drug to be off the street that's not prescribed by a physician to be safe.
And methamphetamine is a vasoconstrictor, correct?
It often can act as a vasoconstrictor.
That means it constricts the blood vessels more, correct?
Yeah, correct. That's what vasoconstriction means. Narrows them down more.
You understand, based on the medical records, that there's prior evidence of methamphetamine use by Mr. Floyd?
Yes, sir.
And methamphetamine can cause some changes to the heart in and of itself, correct?
Correct.
In fact, it sort of ages the heart more, right?
I've never used that terminology.
Okay. What does it do to the heart over prolonged use?
Every case is different, and it depends what we mean by prolonged use. So 1 day, 1 week, 25 years. Like most things, if you smoke cigarettes for 50 years, you're going to have more problems than if you smoked a cigarette or a pack every once in a while.
In terms of what does methamphetamine do to the heart itself?
So methamphetamine, if used over a long period of time, can sometimes contribute to the development of coronary artery disease, as we've been discussing. It can constrict blood vessels, as you mentioned. It can have kind of a host of different effects on various parts of the body, including the heart.
And there's lots of things that can make the heart work harder and faster, right?
Sure.
I mean, methamphetamine being one of them,
Yes.
vigorous activity being one of them,
Sure.
adrenaline.
Yeah, I mean, we all right now have a lot of adrenaline flowing through our system. Adrenaline is needed for life, for sure.
Increases in adrenaline can cause the heart to work harder and faster.
Yeah, I mean, so adrenaline, which is the lay term for catecholamines, that's the purpose of adrenaline, is to get it to pump more blood. When we go and exercise, the purpose of adrenaline is so we can run and we can jump, and we ask the heart to allow us to do that, correct?
And have you, in your practice, worked with someone who has a paraganglioma?
I have had a couple of patients who have had what we call pheochromocytomas, which is a type of paraganglioma, yes.
In the hip area generally?
No, generally it's actually near the adrenal gland, which is sort of just near the kidneys. But these paragangliomas can sometimes pop up in different places.
And how are they typically identified?
Well, so it depends. If it was clinically pertinent, that's how I diagnosed the ones that I've had. The classic findings are the person who's saying, I'm always having headaches. What is with these headaches? I'm always sweating. Why am I always sweating? And you start to say, I wonder if something is releasing a hormone that can be contributing to that. Other times, like in my opinion, the case here with Mr. Floyd, you'll pick them up incidentally, say at an autopsy.
They're also often identified because a person, it contributes to high blood pressure.
It can, that is right.
You have agreed that you've reviewed the medical records of Mr. Floyd, correct?
Correct.
And he has a pretty significant history of extremely elevated blood pressures, right?
Yes.
I think the one you referenced, that the top number was over 200.
Yeah, on more than one occasion.
On more than one occasion. And the lower number of the blood pressure was likewise elevated, right?
Yes.
Did you observe evidence that in the medical records that Mr. Floyd was taking prescribed medications to control his blood pressure?
I saw in the records during an emergency room visit that he was prescribed high blood pressure medication. What I could not see is whether he was taking them or not, but it did look like at one point there was a prescription given to him. I think one of them was for amlodipine, which is a calcium channel blocker, and one of them was for, I think either hydrochlorothiazide or chlorthalidone.
And you'd agree that the records that you had for Mr. Floyd were relatively limited. Agreed? I mean, they weren't his entire life medical records.
I don't know when he started to see medical professionals. So for all I know, the first instance in the records that I saw was the first time he started to see medical professionals. I'm not sure.
So how many years of past medical records did you review?
I believe 3 or so. I think the beginning of 2018 is when I think they started.
Are paragangliomas ever removed from a person?
Paragangliomas, if they are causing those symptoms that I mentioned, the pulsatile headaches, the sweating, etc., a surgeon would sometimes remove them.
Would you prescribe an amphetamine for somebody who has a 90% blockage of the right coronary artery and a 75% blockage of the left anterior descending artery?
So, first of all, I don't typically prescribe amphetamines. I have many patients who have coronary artery disease that are on stimulants, okay, for a variety of medical conditions. So I just don't prescribe them, but I do have many patients with coronary disease who are on stimulants.
Would you recommend to someone that they use methamphetamines with that degree of coronary artery disease?
I would never recommend that anybody take methamphetamine off the street for any reason.
Are you aware of the research showing that deaths where both methamphetamine and fentanyl are found, it occurs at a much higher incidence?
Can you repeat that question, please?
Sure. Are you aware that the research has demonstrated that deaths of those who use methamphetamine and fentanyl have been notably higher than meth or fentanyl alone? The combination.
Objection, Your Honor, for lack of foundation, assuming facts.
As to assuming facts, that is overruled. Assuming, is it the scope of his foundation? Since the state did ask him for toxicology opinions.
Sure, but the reference to medical articles, none of which anyone has seen, is simply counsel's reference, Your Honor.
Overruled. You may answer if you know.
Okay. I am not familiar with the breadth of the literature looking at all of the different combination of drugs and which combination worsens or improves survival.
You testified that Mr. Floyd, based on your review of the video, did start complaining of shortness of breath prior to being placed in the prone position, right?
Yes, I heard on more than one occasion he say the words, "I can't breathe."
And if Mr. Floyd had simply gotten in the back seat of the squad car, do you think that he would have survived?
Objection, Your Honor. It's not called for medical testimony.
You may give if you have a medical opinion as to that.
Overruled to that extent.
So, had he not been restrained in the way in which he was, I think he would have survived that day. I think he would have gone home or wherever he was going to go had he not been subjected to the prone and positional restraint that he was.
So in other words, if he had gotten in the squad car, he'd be alive.
I think my answer remains the same. Anything other than that scenario that he was subjected to, I have no reason to think from a medical perspective that he would not have survived that day, correct?
And in terms of the prone position, you would agree that the prone position is not in and of itself inherently dangerous?
In an ordinary individual, if we were to take away heard on more than one occasion he say the words, "I can't breathe."
And if Mr. Floyd had simply gotten in the back seat of the squad car, do you think that he would have survived?
check ER. It's not calling for medical testimony.
You may give if you have a medical opinion as to that. Overruled to that extent.
So, had he not been restrained in the way in which he was, I think he would have survived that day. I think he would have gone home or wherever he was going to go had he not been subjected to the prone and positional restraint that he was.
So in other words, if he had gotten in the squad car, he'd be alive.
I think my answer remains the same. Anything other than that scenario that he was subjected to, I have no reason to think from a medical perspective that he would not have survived that day, correct?
And in terms of the prone position, you would agree that the prone position is not in and of itself inherently dangerous.
In an ordinary individual, if we were to take away everything else that was going on and someone was just simply lying in the prone position, while there are many patients who that would be inherently dangerous, the average individual, I would agree with you, probably just lying flat in that situation generally wouldn't be dangerous.
Even in the ICU, there are circumstances where people have serious medical conditions where they're maintained in the prone position. Agreed?
In the ICU, when patients are put into the prone position, it is when it is a desperate attempt to save someone's life where their lungs have actually developed what we call acute respiratory distress syndrome, or ARDS. They have a ventilator in to make sure that the amount of air that they get, no matter their positioning, will always be enough. And so it's a funny thing to think about putting someone in the prone positioning in the ICU on a respirator, but because of respiratory physiology, sometimes that will actually help open up certain segments of the lungs that are needed for oxygenation. But it's really important to keep in mind that they are on a respirator every single time to open up those lung airways, and they're usually on sedation as well to keep them comfortable.
And my last question, doctor, is after someone's heart stops, is it possible that they continue to respire?
It is, well, I'm not sure I could answer that with certainty other than to say there are these things that are called agonal breaths. So when I'm in the intensive care unit with a patient who is dying and they go into cardiac arrest, once in a while you will see them take one or two extra breaths. I'm not sure the exact mechanism or the physiologic trigger for that. So you could potentially see some extra breaths for a short period of time.
By a short period of time, up to a minute?
In my experience, if the heart has completely, would not expect to see the breathing continue for up to a minute, but I might expect it to be seen for several seconds.
No further questions, Your Honor.
Any redirect?
Dr. Rich, you were asked several questions that had to do, or at least had as a premise, the blockage of Mr. Floyd's arteries. Is blockage a proper medical term to you as a cardiologist to describe the narrowing in Mr. Floyd's arteries?
So when we try to use terminology that is not medical terminology, right, to explain these phenomena, the term blockage I tend to use when the blood vessel is completely blocked. There's a blockage. I will usually describe, if I have a patient like Mr. Floyd who has coronary artery disease like this, I will usually use the term narrowings because the blood is still getting through. In fact, the blood may be getting through just fine. There is no level of narrowing, in fact. Even a totally blocked artery, this is what's fascinating, that develops over time, the territory of blood that blood vessel was supposed to supply can still be getting enough blood because of those collateral vessels that develop. So I would use the term with Mr. Floyd as narrowings.
You were asked questions again about paragangliomas. And I think you told us that those are usually preceded by headaches of some kind.
Classically correct.
One of the symptoms is headaches.
Yes, that is right.
Again, did you hear amongst the various complaints Mr. Floyd may have had about pain, did you hear any of them being a headache?
No. In fact, when I saw that there was a paraganglioma described as an incidental finding in the autopsy report, I actually, when I went to the medical records, I used that Control F button to put in headache and make sure that I never found headache, in addition to scrolling through all the records. I didn't find headaches at any point.
When you referenced paraganglioma being an incidental finding on the autopsy, would you tell the jury what's meant by incidental?
Sure. So all of us have things in our bodies that aren't causing any medical problems, but if they're discovered, let's say someone gets a CAT scan for one reason, they might find that there's a cyst on the kidney or the liver. Sometimes we'll even pick up benign tumors. So we refer to those as incidental findings. In fact, in the case of paraganglioma, the name we would actually call it is an incidentaloma, because we don't think it has clinical relevance, but it was found and described in the imaging, or in this case, the autopsy.
Are you familiar with any of the data as to how many people in the United States have ever died as a paraganglioma as the principal or primary reason for death?
To be honest, I don't know the exact numbers. I just know that they are very low.
Now, you were asked questions about high blood pressure, the role and impact of methamphetamine, paraganglioma, narrowing arteries. Can any of those things in of and by themselves cause someone to die without first injuring the heart?
Can you repeat the question?
Yes, what I'm trying to get at, whether we talk about high blood pressure, methamphetamine, paraganglioma, and the impact on the adrenals, narrowing of the arteries, can any of those things by themselves cause a person to die without first impacting the stoppage of the heart?
Well, the reason I ask you to ask the question again is because I want to make sure that I'm precise and clear here. High blood pressure can cause death in manners outside of the heart. For example, it can contribute to a stroke, which we know Mr. Floyd didn't have. And the other thing that can occasionally happen is this thing called an aortic dissection, where the aorta, the main tube that leads the heart, can tear. That can cause death. So I want to make absolutely clear, these conditions can cause death on occasion in areas not involving the heart, but most of the time, if death is going to occur by them, it's going to be caused because of their impact on the heart.
And did Mr. Floyd have an aortic dissection?
No, he absolutely did not, based on the review of the autopsy.
He didn't have a stroke?
He also did not have a stroke.
So again, just to be clear for the jury, with all the discussion about the narrowing of arteries, meth, etc., was there any damage at all observed to Mr. Floyd's heart muscle?
Based on my review of all of the evidence, the EKGs, the autopsy report, I found absolutely no evidence at all of heart damage in Mr. Floyd's heart.
Thank you, Dr. Rich.
Any recross?
Just one question.
On redirect, you were asked a question about the various, the paraganglioma, the coronary heart disease, high blood pressure, if any one of those can cause death independently, and you answered relevant to the high blood pressure, right? But you would agree that when you combine a lot of factors, you would agree that the body is, a lot of things are happening at the same time, right?
Yeah.
And in combination, if you have a paraganglioma, you've got an increase in the fight or flight kind of response. You've got coronary heart disease. You've got high blood pressure. All of those things combined could cause death, even if there was not a physical restraint.
Well, there's his paraganglioma. The likelihood that his paraganglioma was